Hi everyone, this is Debbie. I'm doing my presentation today on seasonal allergies. So the client I'm speaking of today is Kyla. She's a 14-year-old female who has presented with seasonal allergies. She claims she's tried taking Claritin for the last month and has had no relief with that. She's also said that there's no way she's doing those nose things. Those are gross. So with that, I could only assume she meant nasal sprays and things of the such. And that she would like some relief, clearly. So as far as Kayla goes, she has had allergy symptoms since the age of 8, which she's just kind of handled on a PRN basis. She went to an allergist in the last few months who did some testing and told her she was allergic to some molds, grasses, and pollens. She's noticed that this change of season has hit her particularly hard, so she, with her allergist recommendations and her mom, has decided to try some daily medication. She's tried some Claritin, and again, for the last month has had no relief. As far as her past medical history, she sprained her ankle about 6 months ago playing soccer, and there was nothing else of note. No major illnesses and no other injuries. Both of her parents have seasonal allergies, and her older sister has mild asthma, which her mother said has been controlled with albuterol as needed. No other medications are taken for that, though. Kyla is a freshman in high school and very, very active. She enjoys playing sports outside, especially. She says she plays soccer, basketball inside, of course, and lacrosse. And in the summer, she's outside playing with her friends and doing a lot of outdoor activities, which have, of course, been hindered with this allergy issue. The only medication she's been on is this Claritin for the last month and hasn't taken anything else of note. Her only allergies, again, are the mold, grasses, and pollen. As far as her examination, she's a well-nourished and fit 14-year-old girl presenting with itchy, watery eyes and has sneezed a couple of times while in the office. She denies any shortness of breath or pain at all with anything that she does, and her lungs are clear and without adventitious sounds bilaterally. Some of the options for Kyla, well, the best solution, of course, is avoidance. So, but with change of season and things like that, it's going to be particularly hard for her to not go outside, and she shouldn't have to. She can avoid things such as raking leaves and doing anything specific with molds and in hay barns and things like that. But as far as just being outside, that's a pretty difficult thing to avoid. So with saying that, one of the options would be a first-generation antihistamine. An example of that would be Benadryl. It's very cost-effective, but highly sedating. So being a high school teenager and being as active as she is, that's clearly not an option for her. Or a last resort, option for her. Another option would be a second-generation antihistamine. These are far less drowsy. They do have a longer onset than the first-generation antihistamines. The Benadryl works very quickly, but so this takes a little bit longer to work, and it is a little bit more costly, but it's not prohibitive. Examples of those would be an Alavert, Zyrtec, or Allegra. I thought that these would be a better option for her. And of course, other options, again, would be some sort of nasal spray the Pantanase nasal spray was definitely not an option for her. She specifically said she did not want to try those. And lastly would be an anti-leukotriene. An example of that would be Singulair. This blocks the leukotrienes that trigger allergy reactions. This is a good option for someone who is pre-asthma, and that is not Kyla at this point. She's just suffering from seasonal allergies, so this would not be the best option for her right now. So the goals of her therapy, of course, to alleviate allergy symptoms. This would be the biggest goal. Her best and most important goal is to get her back on the sports field again, feeling better and not having to stop and sniffle and sneeze and such. So another goal of her therapy would be to encourage her mom and her, she's old enough, to clean the home, including her sheets and blankets, to eliminate allergens that may be in the home. The medication I selected for her was the Zyrtec. This again is a second generation antihistamine, so meaning less drowsy symptoms, less drowsy side effects. However, a little bit more cost prohibitive and a little bit of a longer onset of time. The benefit of this, though, is that it's a one-time daily medication, so she would have to do because of her age being 14, so she's over the age of 12, which under the age of 12 they had kind of mixed reviews as far as the amount of medication that should be taken. But because she's 14, that wasn't even a consideration. She's okay to take the 10 milligram tablet one time daily. She's not to exceed 10 milligrams in one day. There was some research and things done on a 5 milligram dose that might be used for less severe symptoms, but it was pretty overwhelmingly for the 10 milligram pill. The cost ranges for the pills were anywhere from 50 cents to $1 per pill, depending on the retailer. And these come in anywhere from 5 pills in a package to 70 pills in a package, so I just broke it down per pill. It may not seem that expensive, but when you're looking at one a day for 30 days, it's $30 a month at the most, where something like the Benadryl might be 3 cents a pill. So a little bit more expensive, but again, if it's working, it might be worth it for her. The Zyrtec remains in the system for about 21 hours before it's excreted, with a half-life of 8 hours, which is why I would recommend that she would take it in the morning. 70% of this is excreted through her urine, and studies have shown that taking it with food does not show any significant effect, so it wouldn't matter if she took it with or without a meal. The absorption happens quickly and occurs at about 1 hour. Again, a little bit longer than the Benadryl, which is about half of that. Interactions, it overall is a pretty safe medication. It was contraindicated in those with severe renal impairment, a precaution with the use of alcohol, but since Kyla's only 14, this wouldn't be an issue with her right now. In rare cases, may cause drowsiness or dizziness or fatigue or dry mouth, but those incidents seem very low. The plan for Kyla, I would have her just stop taking the Claritin, clearly, if it's not working, and begin using the Zyrtec once a day as needed, especially during the changing of seasons. I think if her symptoms were alleviated and it's the middle of the winter, then I don't think she would have to take it. She found herself going into a situation where she would be at risk of having some sort of reaction, then she would take that before she would get there. But during the changing of seasons from spring, and then also into fall would be a good time for her to start taking these, and if she knows that she's going to be out on the soccer field or something for the day. I would ask that she give the change a week or so to settle in before determining the efficacy of the new medication. You know, it's something that should take effect pretty quickly, but I don't want her making any assumptions after a short amount of time. She did give the Claritin a month, so I think that would be a fine amount of time as well. I would just suggest that they buy a small amount of the Zyrtec to start, as to not, you know, invest in a large amount if it's not going to work as well. If there's still no success, I would suggest moving on to another second generation antihistamine, such as the Allegra. Again, a little more expensive, but I would stick with the second generations at this point. I would recommend that she take this medication at the same time every day, preferably in the morning, as it's something that she would need to utilize throughout the day, and then I would educate her on avoidance, knowing what she's allergic to and where to find those things. And then I would also recommend that she avoids any activities that involve pollen, mold, or grass. You know, and those would be, again, things like raking or putting herself in a musty room or anything like that. So, Carla, and I hope she feels better. Thank you.